started then.
Sure.
Again, thank you, Dr. Carter, for being here. It's just a thrill. I'm Peter Schwartz. I'm the director of the Bioethics and Participant Advocacy Program, BPAP, of the Indiana CTSI. And we do this series monthly or every other month about research ethics and translational science. And we try to make it as applied as possible. Our target is people who may not know very much about ethics as a field, maybe researchers, to bring them up to speed with some of the big issues and questions and ethical issues in doing translational research. And these are usually about 20 or 30 minutes long, sort of a shortish talk. Again, Dr. Carter, go on as long as you want. But they also, we then have some discussion, and I see already a bunch of people on here who could contribute a lot to the discussion, may ask you some questions. It's a funny story. It's one of having Dr. Carter here. She is an associate attending behavioral scientist at Memorial Sloan Kettering. She's director of the Tobacco Cessation Research Program, a very important role in New York, Memorial Sloan Kettering. And she's a proud IU product, I'm going to say, although her training was elsewhere, but she was a postdoctoral fellow here, I believe, an assistant professor with Sue Rawl, my close collaborator, and other people over at the nursing school and across the campus. So it's a thrill to have you here, Dr. Carter. I'll just say one last word, which is that Dr. Carter gave a presentation on roughly this topic, which on a different program, and we saw it and we're thrilled by it, and so it's perfect for treats. So we asked her to come here and do a version for treats, and we're again thankful to have you. And again, Dr. Carter, you have the floor, and I'll even turn off my
Awesome. Thank you so much. And thank you for the invitation. Let me go ahead and share my screen. So just to get a sense, okay, wait a minute. Let's see. Can you see that? Yes. And I can do slideshow view. Can you see that? Well,
it is perfect.
Yay. Okay. Okay, so this is actually an abbreviated form of the talk that I gave for the digital ethics presentation earlier this year, when Peter asked me to present I do a lot of social media related research, and I've also kind of dabbled in the ethical considerations of that research. So it's a personal interest of mine, because research has transitioned over the years to multiple platforms from your more traditional platforms, and I think it's important that we think about, how do we protect human subjects when we're leveraging different tools to recruit and also intervene. And so what I'm going to present today is more of a condensed format, and you can stop me at any time, interrupt me, ask questions. But my hope is to have a dialogue at the end of what you guys are running into or have questions about, or your experiences. And so I'm just going to give us really, really brief overview. Everybody is completely I can't see anybody because you all have no cameras on, but I'm just curious, are there people that are doing social media based research in your all's group? Do you know that, Peter? Because nobody's... You're muted, Peter, if you're saying something.
I know how to turn on my camera apparently, but not my microphone. I'm after years of Zoom. Yeah, no. So I don't know if everyone wants to pipe up and say, here's Emily Mueller.
I see. Here's chat.
A comment. Again, feel free to turn your cameras, people. It's not a big group. You're welcome to ask questions, or I'm sure Dr. Carter will be happy to hear questions or thoughts anywhere along.
And if you're at home, we expect you to be at home, so I don't expect you to look perfect or that's fine. So it looks like Carolyn, you're about to engage in it. Yay. And Emily, you've tried, and Colin, you have. So some experience with it, and some not, and some may be interested in exploring that. Okay, so I asked that just so I know how much to say in this part about social media based research. I like to talk about all the platforms. When you're thinking about social media, I'm referring to Twitter, Facebook, Instagram, also WhatsApp, and actually YouTube is considered social media if you get really particular about it. But if you look at the different platforms, they are meant to be used for different populations, obviously, because the different platforms have different age demographics and people who use them. Years and years ago when I first started using Facebook, I hate to show my age, but it wasn't that, like it was pretty new. It was really, it was new. It was a fad. It was great. And younger people were using Facebook at that time. But then, because older people started, and when I say older, I mean like me, started getting on Facebook, then the younger people went to a different platform. They went to Twitter, actually, and other ones, Instagram. But so you really find that the demographic of Facebook is older when you look at other types of platforms like Twitter and Instagram, and definitely Snapchat is a younger platform. But I just point that out just because it's really important when you're considering doing social media based research of who is your target population that you're trying to recruit into a research study, and it doesn't make sense to go that way. And so this just gives you an example of how these different platforms have been used for different types of either recruitment or intervention. I use Facebook targeted advertisement a lot simply because I do lung cancer screening related research, and my patient population is age 50 to 80. And so that makes sense for me. But I've also assisted with some others who have done, built an online community around cervical cancer screening on Twitter, or, a younger generation, trying to target a younger generation with Instagram ads, or direct messaging through WhatsApp. They both have their advantages and disadvantages. So what types of studies? You really can do anything with social media based research. I think it's interesting because social media research is really just another venue to recruit. Depending on whether you're talking to the IRB or not, you might have to explain what you're doing and how it's not different than you going and putting up a flyer in someone's clinic with a tear-off thing, because really it just is the medium through which you are trying to get your information out to your target population to recruit them into either a survey study of recruit for focus groups. We did that when I was at IU. We used social media to identify individuals, but then we kind of funneled them to our research office so that we could recruit them for focus groups or individual qualitative interviews. And then also you can recruit individuals for intervention studies. You can also deliver an intervention study. And I'll talk a little bit more about that because I actually have a pre-doc who is currently, as we speak, like I met with her at 10 o'clock this morning, who has an intervention study. It's a psychological based intervention study that she's recruiting for using Facebook and then also intervening. So I'm going to give this as an exemplar just for understanding. So what is Facebook targeted advertisement? And I always specify targeted because of the fact that Facebook has the ability to target an ad. Now that's good and not so good in media recently, actually over the past couple of years, that Facebook takes liberties of being able to target either misinformation or different things. That's a whole other discussion. But it is something that you have to think about when you are either writing a grant or submitting to the IRB. How are you protecting against potential misinformation, potential ethical issues that could arise? But I like Facebook's ability to target. It was built for advertisers. You might wonder, well, you probably don't wonder. It's not just Facebook. I mean, Amazon does the same thing. Google does the same thing. If you search for like I searched for pet carriers yesterday, and now I'm getting all these like pop-up ads for all these different pet carriers for airlines. So there are, and that's the targeting piece. So being able to target on a user's key variables to get you to the patient population that you're trying to reach is what this advertising platform allows you to do. And it goes beyond just things that are set up in my profile, like my age or my gender or where I work, what I do. It also includes things that I've liked on Facebook. So if I've liked a particular, like the American Cancer Society page or some other page, it builds in, not built in, it brings those things into this algorithm, and then also by groups to which people belong. So it allows you to set targeting variables about Facebook users that you would like people to see your ad. So you can also, these are just examples of targeting. I think it's really it's helpful that you can either focus on including people from a certain place or excluding them. So if you think about location, you can include people, everybody in this location, or if they live in this location, if they recently traveled through this location. You can also narrow it down by country, state, province, city, or zip code. And zip code is really helpful. I did a disparities related study when I was at IU, and I really wanted to recruit a lot of African American and Hispanic individuals or Latinx individuals into my lung cancer screening study. And so what I did was I used the census to find zip codes that were higher in diverse patient populations, so that I could include and then restrict out those other zip codes that didn't have the patient population I was looking for. These are just giving you examples of everything that you can target on, and there's so much more. This is just examples. And these ideas you can also target based on specific topics. And so these ideas actually come from people I've worked with, either consulted with or had students or mentees or myself or other researchers who have done different studies on like caregivers of diabetic patients. We would target the American Diabetes Association, or you have to kind of think outside the box of what would that individual be interested in. With my particular program of research, I'm looking for people who are eligible for lung screening. So my targeting variables are frequently smoking related, or smoking cessation or tobacco treatment related, e-cigarettes. There's actually certain professions that are higher in individuals who smoke, etc. So when you're thinking about designing social media based research, and you want to think about the ethics, which is the crux of why we're here, I think that's in the treats, the E is ethics, and that thing. We want to really think about a lot of different things. We really, we go back to the basics of thinking about autonomy, beneficence, and justice. And how are these principles demonstrated when we determine different things that are specific to a social media-based platform? Like, how are we obtaining informed consent and making sure that individuals understand in the social or media or digital domain? How do we mitigate the probability and magnitude of the potential harms? And how do we ensure that those who stand to benefit from the research are included as participants in the research? So one thing that we don't necessarily think of in more traditional studies is who is a bystander. Researchers who use social media for research purposes need to be aware of and also consider the rights of bystanders who might inadvertently become a part of this, the study as it's being implemented. And this is defined as a person due to their proximity to the research participant. Think about yourself. If you're at home and you're you're involved in a research study that has an intervention that's online, and your husband is there or your wife is there, and they're walking through the room and potentially being recorded. These are things that you need to think about of how you're going to protect the rights of not just the person who's enrolled in the study, but the person who might inadvertently contribute to the data of the study. And then this is a heavy slide, but I'm sure that Peter can, like, you guys can give the slides afterwards so that you don't have to like read all of this. But there's things that you really need to think about when you are designing ethical social media based research, like the differential risks that may exist for different platform users. What is the nature of the participant involvement of the different users by platform, and to what extent are privacy protections in place and considerations for data security and data integrity as well as confidentiality. Also tailoring communication about risks and expectations. Researchers are ultimately responsible for shaping the ethics of research, and this includes going into the social media space. And so gathering evidence to identify the probability of potential harms to participants and bystanders is really a necessary practice when you're designing a social media based research project and protocol. Another thing to consider is working closely with regulatory bodies to develop standards and update them as needed. When I first started doing this, it was either the IRB was either easy to get through because they didn't understand what was going on, or really hard to get through because they knew enough about social media to ask questions. And so what I find that is most helpful is, regardless of who you're pitching your study to, whether it's the IRB or another regulatory body within your institution, it's really best practice to go in with an educator type of approach to educate about what you are doing, so that you can, it shows that you've really thought through how you're collecting data, how you're collecting consent, how you're protecting the rights of individuals who are participating and those potential bystanders. But it also helps for those that come behind you to submit protocols that this is you know what you're doing, you're protecting, and this is how it's being done. One of the websites that I really like was actually created by a colleague of mine out in California in 2015. The core initiative is the Connected and Open Research Ethics Initiatives that was launched with support from Robert Wood Johnson Foundation. And it's a web-based core platform that includes this virtual community of global researchers. And the point of this, the core initiative, was really to foster ethical design and responsible review of research when you're using emerging technologies, but also social media, and not just social media, but that was a component of it. And so it's really a repository of best practices, shared experiences, asking questions, having peers or experts review protocols prior to initiating them or submitting them. And it is, I think I give here, this is the website down here at UC SD. And it's really nice because you can go in, there's a nice library of different documents that are helpful, as well as you can see where the membership is. This was actually done earlier this year, so this is like, the numbers have likely changed. Are you going to say something?
Lisa, that all the materials you mentioned and like links to the website, those will all be on the page where the recording of your talk will be as well. So
great.
Don't worry. Slides,
Okay.
We'll put them up too if you want to share them. So great, thank you.
Awesome, thanks. So, there's another article that came out last year by Posar and colleagues. It's in the Journal of Medical Internet Research, and this was a really nice article because it talks about the different components of a participant recruitment and enrollment and things that you might want to consider as you're designing your study or designing your protocol to submit to the IRB. This just kind of walks through like an example survey study in which you used social media to recruit, and then you screened individuals and sent them to their survey if they were eligible after they were consented. And so one of the things that you're always worried about in any type of social media based research, which I would also argue any other type of research you could do, but you worry about people who are not who they say they are, who are just trying to get an incentive if you're offering an incentive, or they're taking it multiple times. If they've qualified once, they want to take it again. And so, and also you worry about bots. And so, one thing that we've done in our studies, as well as they suggested in this article, was to use a CAPTCHA or some sort of, checking mechanism so that a robot, like whether you want to have like a simple math equation or, pick the color of the sun and then you have like yellow, blue, green, those types of things, just to make sure it's a real person that is actually taking your survey or applying to take your survey. Having eligibility criteria not so apparent. When I recruit for my studies, because it's lung cancer screening, I usually don't say I'm recruiting for lung cancer screening related studies. I usually have an overarching umbrella of lung health, so that individuals don't necessarily know how to answer my screening questionnaire to get into the study, and hopefully will answer it honestly. And so, like I mentioned before with CAPTCHA, respondents are required to pass a completely automated public Turing test. That's what CAPTCHA stands for, to tell computers and humans apart. And then eligibility screening questionnaire asks respondents to report how they heard about the study, and then you could program in like branching logic to deny access to ineligible respondents. My current pre-doc, she's doing a study on uncertainty around lung cancer screening decisions and prognostic understanding between patients and clinicians, and she actually has them fill out a pre-survey on REDCap, and they have the math equation to check that they're a human, but then it also has some eligibility screening questionnaire that has branching logic, and then it redirects them to if they're eligible. They can't go to the survey right then and there. It actually sends her an email, so it's like a two-step process so that she can check through those answers that are given. So on the study information page, creating a survey access code is really helpful, so that they have to enter a valid email address, and it's not just someone who's creating multiple email addresses or a bot that's using that, and then they have to actually agree to enroll. So when you're thinking about the study information page, especially if it's really important when you're involving a participant incentive, that you are really clear that about that participant incentive, and that evidence of fraudulent activity may result in study removal. This actually was a personal experience at IU that came. There we had a respondent who was actually wanted more than one gift card, went to the IRB. It was interesting. So all of my studies now have this. But the other thing I think is kind of nice to do is if you can, I generally start my studies without advertising there's a participant incentive. And then they find out that they get the incentive at the end to thank them for their time, so that they're not motivated by the dollar amount that they're being, that they see. Some other things to consider with the other pathways onto that red cap survey or any other type of survey. Once respondents agree to enroll in the study, they can be prompted to provide their email address so that you can create a survey passcode that is unique to them, and they can access to ensure that only that person is accessing that survey. And then enrolled participants get an automated email that has a unique link, and you can set that up in RedCap and Qualtrics. All of the major software for programs for surveys allow you to do this. And then another thing that's nice to do actually within a RedCap survey or Qualtrics survey or any survey is at specific points throughout your study, you can have hidden open-ended verifiable items so that you know that it's a human. They're not just clicking CCC or to get through. They actually have to think about the answer to the question. Sorry, my daughter is calling, and she never calls unless I'm actually presenting. I'm serious. She never phones, and I know it's probably nothing.
It never fails. You haven't had a cat walk in front of your camera yet, the way I do. So.
I'm like, it's almost uncanny. I know I'm going to hear from her on the day that I present somewhere. It's like that British guy who had his little kids coming into when we were first in the pandemic. Some other things
Which gets back again to the issues of bystanders. So
yeah. The other thing that they recommend that we've also done with our studies is you can include elements in the actual design of the survey to identify fraudulent responses, like a timestamp at the beginning and end of the survey. What we talked about, those hidden items, they're visible to bots, but they're invisible to humans, and so you can catch some that way. I've had a study where you can always tell when it's a bot. That's because like your number on your survey mechanism is like going up exponentially over 5 minutes, and you didn't have like 99 people qualify to take the survey in 5 minutes. You can also use pairs of items to identify inconsistent or illogical responses, like the timestamp of a time zone and their self-reported location, and then manually distributing participant incentives so that you can review the completed surveys for evidence of inattention or duplicative responses. And that's why that clause in the informed consent is really important to give you license to remove an individual that may not be so above board. In Posar's paper, they actually did they reported on their own study of the evidence that they looked for to that they considered low quality or fraudulent data. And so, if somebody completes a 45 question survey in a few minutes that is suspicious for being fraudulent. They also looked at duplicative responses to open-ended questions, inconsistent responses with the verifiable items like location and zip code don't match, timestamps don't match, and then evidence of bot automation with the hidden items was recorded. And then you can also have there's a software application that can provide automate. Hang on, let me move this. Sorry, can you see this screen? Yes. Okay, good. I've been talking about bots a lot just because I've had some experience with them, but they do pose a threat to the validity of your sample and the integrity of your data when you're conducting online research. And these are software applications that individuals can use to do automated responses in mass to misrepresent themselves to get into a study or other things. They're programmed to rapidly complete online surveys, and so you might want to consider creating a unique paired identifier for an individual. So the example given was require a participant to successfully identify their cancer treatment facility in the U.S. and enter their home zip code to check and see that they live at 10022 and they go to Memorial Sloan Kettering. Oh, thanks. They're not in 9 something over in California. Or create a restricted access component to the survey with that valid email address, which is super easy to and doesn't cost anything extra. So the last piece I will talk about is preserving your sample validity and data integrity. And again, I'm not sure why I have these heavy slides. But it's a lot to think about. So when you start talking about preserving sample validity and data integrity, that really starts from the beginning before you even write the protocol. Developing a written protocol that identifies and responds to potential low quality data by including language that permits your study team to verify the identities if needed. These are just ideas. You don't have to include these in all of your protocols. But including language in your consent that about removing for fraud and not receiving additional incentives, mailing incentive to a physical address to avoid respondent misrepresentation through getting an gift card, and lower the value or eliminate completely the incentive, that if you can, and preparing study advertisements that don't explicitly either state the eligibility criteria or that there is actually an incentive can increase the validity of your sample, because you won't necessarily have someone responding just for the $20 or $30 gift card or what have you. When you're thinking about preparing your data collection instruments, you can use automated invitations, the CAPTCHA or reCAPTCHA, as we talked about before, asking them to tell you where they heard about the study. You can also look at a person's IP address, and but this is a HIPAA, that's actually a HIPAA component, so it needs to be in your IRB application. But if you collect a respondent's IP address, you can actually compare it, and you can automate this within your survey platform to pull out duplicate IP addresses so that you can eliminate duplicative responses or take that person out of the study. I talked about hidden items in each instrument. You can go, you can tag them as @hidden action tag as an item in REDCap, or it can be added through your JavaScript coding into Qualtrics to where the bots see them, but a human doesn't. And we talked about that. I'm on my laptop, so I have to move the panel that has the people's faces over back and forth to get out of the way of what I'm showing you guys. Also, when you're thinking about your data collection instruments, including items like simple things like including items that have embedded directives, like select the third option below. That will tell you that that's a person and not a bot or someone who's quickly going through it. And you're seeing this more and more in research studies that are done online. And then with recruitment, avoid posting links to those instruments in a public space, because they can get shared, and then you have like multiple people that weren't your target audience trying to access them. using targeted advertisements to avoid promoting the study to ineligible respondents. So that's like, targeting your variables within Facebook or Twitter or even LinkedIn to those variables of the people that you're trying to recruit into your study. Limit visibility of study-related social media profiles to audiences in that target geographic region, and then monitor social media user engagement with study posts. When I do my Facebook targeted ads, I have it linked to a Facebook page that's about lung health. But I do monitor the public shares and the comments, because some people are not, they can go down a rabbit hole and be totally, and so you have the ability. I like that Facebook has the ability to hide a comment. They don't know that you hit it. It still shows for them, but nobody else can see it. So it's not creating. Before, Facebook didn't have that, and you could only delete it, and then you'd have somebody go on there and they're deleting my comments and free speech, da 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 da. Monitoring for suspicious patterns, etc. And I think we're almost, yes, we are done. I was trying to do the 20-minute thing that Peter said he wanted. I did do the 20. No, I didn't. Oh, I did 40.
You did great. You did great. You did 20 minutes before the hour. That's great. We say 20, we expect 40. That's the way we professors are. I've gone over too. Okay. What a wonderful presentation, Lisa. I'm going to open. You can call on people. I've got a few questions, but I'm going to let people who are attending to ask questions about this. I think you'll have some. So go ahead, please. People can just unmute themselves and ask. They can raise their hands. It's relatively informal.
I can start calling on people. I really like Jody's profile picture in front of the books. That's nice.
Colin is unmuted, and he's not shy. He is not the Loch Ness Monster, but look at his picture.
I love your profile pic. That's nice.
Thank you.
Can I ask a quick question?
Sure.
I was wondering whether you had any thoughts about Amazon Turk, because I know that I've used that before, but all the questions of validity are top of my mind, and I know that there's been some concerns definitely in the methods literature about that.
Yeah, so I've personally never used it. I've reviewed papers of people who have used it, and I also have colleagues that have used it in the lung screening space, actually. And it does have some issues, and I understand what you mean by the methodological issues that can also lead into potentially not gaining a true representation of your target population. But my colleagues had issues getting their papers published when they used Amazon Turk because of I guess the threats to validity that were viewed by reviewers, and so I've never personally used it just because of that. That doesn't help you, but I'm just telling you that's my experience. Oh, wait a minute.
Thank you.
Oh, sorry.
I saw that Andrew came off. He put on his camera anyway, and Jody came on. I'll ask quick questions just following up on that. There's so much of what you're saying here, Lisa, has to do with, I call it the research ethics around validity. Right, so we always say in research ethics, we worry about informed consent and beneficence and justice, but actually one of the central issues of research ethics is, do you do research that is valid, right?
Yeah.
Because you shouldn't be doing research unless it's valid. And what I loved about your talk was that you really focused on how to assure validity and the big dangers of validity of doing this kind of research. And that's an issue, of course, selfishly for getting it published and getting your next grant, but it's also, of course, the ethics of research. You shouldn't be taking people's time, taking resources unless it's valid research. And so I guess I would say, do you feel comfortable with this now? You presented a tremendous variety of approaches that sound powerful. Do you feel like the validity is there? Are you worried about things like fake. Sounds like you've got enough tricks. The bots haven't figured it out yet, though they will next, right? So it's just a war of escalation. They'll start having emails of their own or something. But then the second thing is the issue of attention and being filling out research sort of remotely, and whether you can assure attention, whether the quality of the data is there. I just don't know if you feel like, are we there? Is this a valid way of doing research? It sounds like you think it is.
I do think it is a valid way to do research, but I think it has to be done with a researcher that's very thoughtful to all of these components that could arise. I mean, you have varied levels of experience with this, and if you're just going to place an ad and recruit people into a study without addressing these things, I think that I do worry about validity, because I know just from studies I've done when I've collected 600 different responses, but I weed out different things because I know this is not that it's not valid. And like what you said, it's not helpful to me or the state of the science if I am collecting data from individuals who really aren't who they are supposed to be, like in my case, lung cancer screening in eligible individuals. But yeah, I think we can reach with a healthy skepticism, a level of skepticism, a good level of sample validity, but with thought and from, like I said, before you even write the protocol or the proposal, you really need to think through all of the steps of how you're recruiting, how you're intervening, how you're collecting the data, how you're storing the data, how are you going to address all of these different things. And I see Sarah has a question. Sarah Honecker has a question.
Hi, thank you.
Hi.
Super interesting. I actually have a couple questions.
Okay.
And I joined late, so I apologize if this is something you covered. Functionally, the CAPTCHA, can that be done within REDCap? How does one go about doing that?
So that's actually, you can do it through Google. It adds it to REDCap. We have our REDCap administrator at MSK has it's like an added component to the REDCap survey. But you can also get around that from, if you can't do the actual CAPTCHA itself, you can get around it by doing like the simple math equation. I don't know if you were here when I said that too. We've done both, where we've included the CAPTCHA as well as the other. Sorry, I've got to.
And then I guess relatedly, let's say you're not offering an incentive. What is the rationale of the bot? Like, why would they want to fill out my survey? I mean, I don't quite understand, I guess, where this is coming from, and
usually you see bots when you are offering an incentive, although you could have an individual who's launching a bot, because even though you haven't said you have an incentive, that they might think they're going to get an incentive. And then you just also have people who are just malicious, who have nothing better to do than to, I mean, I could think of a lot of better things to do than to just sit there and look for surveys to try to take, but it's a program, so it's easy for them to deploy. It doesn't take extra time for them to do that. But it's much more greater possibility when you're offering an incentive.
Okay. And then my last question, so one of the experiences that I had doing an adolescent survey, that we used targeted Facebook advertising and also Instagram, and it was open for comments, because you can't when you have a Facebook group, you can't prohibit comments. And we did get some adolescents who were making, I don't know if I would call them suicidal, actively suicidal statements, but there were references to death and dying, and that was not expected. So I didn't know if any of you, or if you have any guidance on that, on how to handle that, or sort of ethics or liability issues related to that.
What's your topic area? What were they? What was this about?
It was on adolescent sleep. Yeah.
Yeah, so you didn't think that they would come in and say, sure, sure. So generally, when you have a study that's recruiting like via Facebook, and it's an actual page like that, you need to have a plan to address. I understand exactly what you mean. You don't think that you're going to have any psychological distress or issues. I look at lung cancer screening, and I still have to do this in my IRB protocols. I have to address how, if someone gets psychologically distressed or has suicidal or homicidal ideation. With it being an actual Facebook group, I would think that you would want to monitor as you have been, but also have in place how you would refer that individual for assistance, whether it's with their primary care physician. It really gets into a sticky place that an individual is saying. Were they saying, I want to kill myself, or was it just around death and dying, or?
It varied. I mean, it could be, so they were talking about how COVID has affected their sleep, right? And then that would sort of bleed into how it's affected their well-being. And it could be things like, I want to die, or
Yeah.
I just don't want to go on, or it's just too much for me. Or in some cases, like, I have been suicidal.
Yeah. So in that case, I really think, you have to treat it just like it would have been an in-person recruitment, and you do have to address if someone is saying that they are suicidal, trying to connect them with. You have to do your due diligence to try to connect them with resources, whether it's a 1-800 line or what have. I'm not asking you to go to try to figure out where they live and go to their home or anything like that, but you could send a direct message to them.
That's what we did. We
Yeah.
just sent them a hotline, but yeah.
Yeah.
And then it comes down to, so like, how often is it reasonable to monitor? And what if you or comments on comments on comments?
Well, you can set it up to where it actually notifies you, so you don't have to go into like right now I have my students' Facebook ad is actually set up to email me, and anytime somebody posts a comment, it emails me to my email. So I don't have to log into Facebook to look it up. I can click on the email and it will take me to that comment directly, but I see it because I'm on my email all the time.
But what's interesting about this, so I really appreciate your questions, because the online community, of course, creates a connection where, like you're saying, there could be an infinite amount of attendance to comments that are issued, much beyond what you get from in person, where you only have that one conversation and then they're sort of gone. If they develop suicidal ideation later, you wouldn't hear. Whereas if it's an online interaction and there's a way to comment, then at least you get a page in the middle of the night that somebody's mentioning suicide. And so it's a question of how do we balance our interest in being researchers and our beneficence towards our patients. We are concerned about being able to head off bad outcomes we might become aware of, with the burden of almost becoming a provider, right? Of becoming almost a VIP provider that you can email in the middle of the night with your thoughts. So it's a fascinating issue that it's more distance but more connection. And that's a really interesting question. I have seen studies get bogged down in that question about how to handle the issues of, for example, suicidal ideation over online, and they just can't figure out how to handle it. It's a really big issue for that study, and ethically as well as regulatory. Can I bring your attention, Lisa, to an online a chat comment? When I'm talking, I don't always see the chat. I don't always have it open. I don't see any hands up. Actually, Sarah's is still up, which is fine. But Mary Ott wrote a chat. She says she can't come off mute right now anyway. But along that validity issue, again, looking at recruitment here, those Facebook samples, again, gave us the opportunity to go broad, for example, to highlight and maybe even prioritize certain groups that may not be adequately recruited in person. But is there downsides to that? Are there limitations to that environment? You mentioned the age issue, but nobody younger than me uses Facebook. But are there other things you've noticed about getting for example, those who are technologically literate, perhaps?
So Mary has a very good point when you think about generalizability and being worried about the population that you recruit. So yes and no. I think so. One of the things I've done for my studies or my patient population is I actually did a pilot study and I used both recruitment methods. And then I compared the demographics of my Facebook recruited sample to my more traditional recruited through newspaper advertisement, stuff of that nature. The other thing that you can do is you can do post hoc analyses afterwards. And we usually do that to look at particular variables of interest like race, ethnicity, socioeconomic status, and geographic location. If the nice thing about Facebook or any social media advertisement is if you do this and if you don't wait until post hoc analyses and you do this kind of as you're doing your recruitment to see the types of people you're recruiting into your study, you can course correct during your study by turning off certain zip codes if you're not getting enough of a certain patient population that you're looking for. But inherently, no study, no recruitment, and no study unless it's a pure experimental study without humans with a rat in a lab, you're going to have issues that you're going to have to deal with, with limitations that you're going to have to address. Sarah's question is a vulnerable patient population, but we have additional ethical obligations to protect children. For all teen studies, we should assume that disclosures will happen and IRB. Yes, indeed. So wait a minute, is that Mary's question or was that Sarah's question or?
I think Mary was following up on Sarah's question.
Okay.
Okay. And emphasize
the
issue as a vulnerable population. Mary does a lot of, Mary, probably from your time at IU, she does a lot of work on adolescent research with risk behavior.
Yeah.
Excellent. Other questions, folks? I was going to ask other frameworks. You mentioned Facebook. You do not do work with like Snapchat and Twitter and Instagram.
No, well, Instagram is owned by Facebook, so you can actually link your Facebook ad to your Instagram ad. I've done Twitter. I've also done LinkedIn. I haven't done Snapchat because it's actually quite expensive. I'm a pediatrician. Okay. It's quite expensive. It would be great to be able to reach younger demographics, but it's actually quite expensive because you're essentially paying for the market. It's a marketing fee that you're paying just like Facebook, and they don't have a tiered thing like they do with Facebook. It's quite expensive.
A final question I had then, if nobody else is gonna, come on guys, you're gonna shut me up. You gotta ask a question, but I'll be done.
I have a question.
Oh, thank you.
So this might not be, it's a little bit different of a question, but I do research among responses for Twitter and Facebook, like Facebook comments and Twitter, posts or tweets, I guess they're called, Twitter posts. And I just can't find any good search engines, ways of accumulating that information. So when I do the IRB application, they ask, how are you going to collect the information? And I'm like, well, I don't know, because it seems like, these things are often programmed in Python and they change every time I do a study. So I often get caught in that, that chasm. It's horrible.
So have you ever reached out to the people at IU Bloomington who do big data analysis around Twitter? I know in our
the Survey Center for Survey Research.
Yes and no, no, no. So Wendy Miller, who's a associate professor in the School of Nursing at IU, there where you are, she does a lot of epilepsy research, but she has a funded study right now with, oh, I think his name is Rocco. It's I worked with her when I was there for some time. They have a way to actually extrapolate. Twitter posts because we did some word adjacency
Great.
graph modeling.
Yeah.
Yeah, and looking at Twitter posts of comments of different around like policy and legislation was what we were doing. But really, I think it is difficult to do unless you actually have that kind of coding experience to be able to pull it out of Twitter or Facebook. And I can connect you with Wendy if you'd like.
That would be great. I mean, I can email and just say I saw your presentation, but that is really helpful.
Yeah, no, she if
Thank
you reach out to Wendy
Miller in nursing.
Wendy Miller in nurses. I think it's W.
Thanks.
No, it's Wendy Miller. But her email is actually her maiden name.
Great, thank you.
Yes.
Okay, we're at our time limit.
Can I ask a question?
Carolyn, go ahead.
Yes, if I have respondents take a survey and then I redirect them to a URL to another survey to give information for the gift card, does that lower my risk with bots and things like that instead of having it going automatically?
If you redirect them to
Yes.
Yeah.
So
yeah, if you add different layers, it would yes, it would, because having the different layers they would have to actually do different steps to get to that email address that they're going to enter. So yeah, I think that's a great idea.
Okay, thanks.
Okay.
Great. Well, what a great conversation. Again, Lisa, it's like you're still here at IU. We miss you. And thanks to the world of Zoom, we can have you this way. So thanks again for doing this. Thanks everybody for attending. If anybody wants to go to the IU Center for Bioethics website, all of our Treats talks, the recordings of them, linked resources are all there. Please come and check that out. And always call me or anybody from BSAP. We actually are at the email bsap@iu.edu. And we can do a consultation for you. We might even reach out to Lisa for help from her on these questions. So thanks again so much, Dr. Carter.
Thank you. Have a
See
good
you
evening.
soon.
Okay.